Welcome to the deep dive. Today, we're really going to cut through some of the noise around a pretty interesting compound, Sermorelin. And specifically, its elegant way of approaching growth hormone modulation. We're joined by our expert guide today to help us unpack the science behind it all. Make sure you walk away really understanding this.
It's great to be here. Sermorelin is definitely a fascinating topic. It gives us a really good look at how we might support our body's own systems rather than just, overriding them.
Yeah, support, not override. I like that. And what really caught my eye is how it apparently stimulates your pituitary gland to release growth hormone in, like natural pulses. So it keeps your body's own feedback system intact, right? Like a gentle coach, not a replacement part.
That's a perfect analogy, actually. It works with the body's physiology.
Okay, let's unpack this for you. So to kick off our deep dive, can you just lay the groundwork? What exactly is Sermorelin at its most basic level? What's it designed to do in the body?
Absolutely. So Sermorelin, at its core, it's a synthetic peptide. That means it's made in a lab. It's a specific chain of 29 amino acids. Now, why 29? Well, your body naturally produces something called growth hormone releasing hormone, GHRH. It comes mainly from your hypothalamus deep in the brain. And GHRH is basically the go signal for growth hormone release. Scientists figured out that the first 29 amino acids of that natural GHRH molecule are the really active part, the fragment that actually flips the switch. So Sermorelin is basically a lab-made copy, an analog of that exact active piece. It's designed to perfectly mimic your body's own signal.
Okay, so if I'm getting this right, it's not growth hormone itself we're injecting or taking. It's more like a messenger. A very specific instruction telling my body, hey, release your own growth hormone now.
That's precisely it. And that distinction is absolutely crucial. We call Sermorelin a growth hormone secretagogue. Fancy term, but it just means it stimulates secretion. It doesn't add outside growth hormone. Instead, it interacts with your own body's machinery. Think of your pituitary gland where the GH is stored, like a vault. Sermorelin is like the key, specifically crafted for the lock on that vault. It turns the key, opens the door, and lets your own stored growth hormone come out. So it works with your system, not by just flooding it from the outside. That's really key to understanding it.
That vault analogy really helps picture it. Very targeted. It sounds like a pretty sophisticated approach. What's the history here? Was it always meant for, say, wellness or anti-aging, or did it start somewhere else?
Oh, its journey is quite interesting, actually. It tells you a lot about how drugs evolve. Sermorelin was actually FDA approved way back in the late 1990s. It was sold under the brand name GHRH, I believe, and its main purpose back then was diagnosing and treating growth hormone deficiency, specifically in children. The idea was, stimulate a child's own pituitary if it wasn't working well enough, which seemed more natural than just giving GH shots. But then it was voluntarily discontinued by the manufacturer in the early 2000s.
Discontinued, was there a safety issue, or did it just not work?
No, and that's the important part. It wasn't pulled for safety or efficacy reasons at all. It worked. It was really more of a strategic business decision by the company. Probably market competition, maybe the rise of other GH therapies made it less profitable,
Well, but business reasons, that's critical context. So if it's not a mass-produced drug anymore, how are people accessing it today, particularly for these, like, adult wellness uses?
Yeah, this is where things get interesting with modern medicine, especially in that whole wellness and age management space. You won't find Sermorelin at your average corner pharmacy, but it is available through specialized compounding pharmacies. These are licensed facilities that can make customized medications for specific patients based on a doctor's prescription. So for adults, it's prescribed off-label. That just means it's used for something other than its original FDA-approved purpose. And in that context, yeah, it's widely used in age management clinics, wellness practices. The goal there is usually to support or boost the body's natural GH production in adults who might be seeing that age-related decline. It's still that same GHRH mimic, just accessed differently now.
Okay, that really sets the scene. We know what it is and its history. Now, let's get into the how. How does it actually do that coaching job on the pituitary? What happens once it's, injected?
Right, the mechanism. It really is quite elegant, biologically speaking. So once it's injected, usually just under the skin, Sermorelin gets into your bloodstream. It travels pretty directly to the anterior pituitary gland, that little gland at the base of your brain. Now, the cells on the surface of this gland have specific receptors, like tiny docking stations, specifically for growth hormone releasing hormone. Sermorelin is designed to fit perfectly into these GHRH receptors. It binds to them. And that binding action perfectly mimics the signal your brain's hypothalamus would normally send using natural GHRH. It's that binding that triggers the pituitary cell to release the growth hormone it has stored inside.
Okay, but you mentioned natural pulses earlier, so it's not just like opening the floodgates and keeping them open, right? That doorbell analogy you use. Can you expand on that? Why is a pulse better than a flood?
Yes, the pulsatile nature is absolutely key. Your doorbell analogy works perfectly here. Sermorelin doesn't just lean on the doorbell continuously. It gives it a good ring, a stimulus. And the pituitary responds by releasing a burst, a pulse of GH. This is super important because it mirrors exactly how your body releases GH naturally. We don't have steady levels. GH comes out in these distinct rhythmic pulses. The biggest one is usually during deep sleep at night, but you also get smaller pulses after things like intense exercise. By stimulating these pulses, Sermorelin works with that natural rhythm. It respects the body's timing and its own regulatory controls. It's not overriding them with a constant high level, which wouldn't be physiological. It's more like tapping the thermostat gently when needed, not just cranking the heat up and leaving it there.
That makes a lot of sense physiologically. But if it's telling the pituitary to release GH, what stops it from releasing too much? Does the body have like built-in safeguards that still work?
That's a great question, and yes, absolutely. The body's natural checks and balances remain fully operational. There's a really important inhibitory hormone called somatostatin. Think of it as the natural brake pedal for GH release. If GH levels start to climb too high, or if the body decides it's not the right time for a big release, somatostatin levels rise and effectively tell the pituitary, okay, hold back now. Because sermorelin works through this natural system, by ringing that doorbell, it doesn't bypass the brakes. Somatostatin can still step in and regulate things.
Got it. So sermorelin itself doesn't override the safety features.
Yeah.
Because it uses the normal pathway, the body's own off switch, somatostatin is still working. That sounds way safer than just injecting straight growth hormone where you'd bypass that natural control, right?
That's precisely the advantage, yes. It's considered a more physiological approach. When you inject synthetic GH directly, you do bypass those feedback loops. Levels can go much higher than your body would ever naturally allow. With sermorelin, because it encourages these natural-style pulses, especially if taken at night to align with the body's main surge, the pituitary receptors don't get constantly hammered. This helps avoid something called tachyphylaxis.
Tachyphylaxis, what's that?
Yeah. Tachyphylaxis is basically when your body stops responding as well to something after repeated exposure. Think of it like, if someone keeps shouting the same thing at you constantly, eventually you just tune it out, right? Your receptors become less sensitive. If you constantly flood those pituitary GHRH receptors with a signal, they can become desensitized. The peptide becomes less effective over time. Sermorelin's pulsatile action, giving the receptors breaks between signals, helps prevent that. It keeps the pituitary responsive. And what's really interesting, some research even suggests sermorelin might do more than just release stored GH. It might actually signal the pituitary cells to make more GH. It could potentially boost GH gene expression, helping the pituitary build up its reserves.
Whoa. Okay, so it's almost like exercise for your pituitary gland. Instead of just draining the tank, you're maybe encouraging it to build a bigger tank over time.
That's a fantastic way to think about it. Yeah, boosting GH gene expression means telling the pituitary cells, hey, make more of the machinery and the raw materials needed to produce growth hormone. So it's not just prompting release, it's potentially strengthening the whole system, supporting the entire growth hormone axis long term, making it more robust. But there is a key limitation here, of course.
Wow, okay. What's the catch?
It only works if the pituitary gland is actually capable of producing growth hormone. If someone's pituitary is severely damaged, maybe from disease or injury, sermorelin won't help because there's nothing there to stimulate. In those cases, direct GH replacement is needed. But for most people with just age-related decline or suboptimal function, sermorelin offers a way to optimize what they've got.
That makes perfect sense. The hardware needs to be working for the software upgrade to take effect. Okay, so we know how it works now, stimulating your own GH. Let's talk about the why. Why are adults, especially as they get older, increasingly interested in this? We associate GH with kids growing, but what's its role in adult wellness?
Yeah, it's easy to forget GH isn't just for getting taller. It's absolutely vital for adults, too. It plays a huge role in so many things. Think metabolism, how you handle energy, body composition, muscle versus fat. Cellular repair, keeping tissues healthy, muscle mass maintenance, fat regulation, bone density, even energy levels, mood, maybe cognitive function. GH is involved in all of that. The challenge is, as we all know, our natural GH production declines pretty steadily as we age. It's called somatopause. And that decline is linked to a lot of things we just accept as getting older, like the dreaded middle-age spread, lower energy, slower recovery from, well, everything. So the idea behind using sermorelin in adults is to gently nudge GH production back up towards more youthful, optimal levels. The aim is to maybe counteract some of those age-related changes, boost overall wellness, vitality, basically help your body run more smoothly like it used to.
So you're essentially using it hoping to feel a bit more vigorous, more
Oh,
youthful,
yeah.
spry.
Spry is a good word for it, yeah. A lot of people, maybe starting in their late 30s or 40s, look into Sermorelin through wellness clinics to tackle those kinds of things. You know, that persistent fatigue coffee doesn't touch, the belly fat that won't budge, feeling like your muscles aren't as toned, maybe sleep isn't great, libido's down. And while the really big definitive studies specifically on Sermorelin for adult wellness are maybe fewer than for direct GH, the clinical observations and smaller studies point towards consistent benefits.
Okay, so what specific benefits are commonly reported in that research or from clinical experience, especially things like body composition or metabolism?
Right. Well, one of the biggest drivers for people is definitely improved body composition. Growth hormone, remember, is anabolic. It helps build and maintain lean muscle. It supports protein synthesis. At the same time, it's lipolytic. It helps break down fat. So, by gently boosting GH, Sermorelin can help shift that balance. You tend to see an increase in lean mass and, importantly, a decrease in body fat, particularly that visceral fat around the organs. That shift alone is often a major goal for people.
And how does that connect to metabolic health overall? Better body composition usually means better metabolism, right?
Exactly, they're tightly linked. When you have more muscle and less fat, especially less visceral fat, your metabolic health generally improves. Research, mostly on direct GH, but the principle applies, suggests potential for better fat metabolism and maybe even improved insulin sensitivity. Now, you have to be careful. Very high non-physiological GH levels can actually worsen insulin resistance. But the modest, more natural increases from Sermorelin, especially by reducing that metabolically active visceral fat, seem potentially beneficial for how your body handles glucose and insulin. It can support overall metabolic function.
Interesting. Okay, so physical changes.
Oh,
But
okay.
the more subjective stuff, like how people feel, energy, sleep.
Oh, yeah, those are huge. Many users report noticeable increases in energy and vitality, just feeling like they have more stamina, more resilience day to day, maybe more drive for exercise. And sleep, that's a big one. Since natural GH release is so tied to deep sleep cycles, taking Sermorelin before bed often leads to reports of significantly improved sleep quality. People describe deeper, more restorative sleep. And of course, better sleep has knock-on effects, better mood, sharper focus, better cognitive function during the day.
Okay, better sleep, more energy, maybe building a bit of muscle while losing fat. I can see why people might start thinking fountain of youth.
Hey, yeah, the phrase comes up, but I always urge caution with that. Fountain of youth implies like a dramatic reversal of aging, and that sets the bar too high. The changes with Sermorelin are usually subtle, gradual, cumulative. It's more like after a few months, someone realizes, hey, my workouts feel better, I'm recovering faster, my genes fit better, I'm sleeping like a rock. It's better framed as age support or maybe age optimization. It helps cushion some of the declines rather than actually turning back the clock entirely.
That's a really important distinction for managing expectations. And I'm guessing Sermorelin isn't some kind of magic bullet that lets you ignore healthy habits. Like, you can't just eat pizza on the couch and get ripped because you're taking it.
Oh, absolutely not. That's a critical point. Sermorelin works best as an adjunct to a healthy lifestyle. It amplifies the results of your efforts with diet, exercise, sleep hygiene. We see the best results consistently in people who are already committed to those fundamentals. Sermorelin can give you a helpful edge, maybe more energy to exercise or better recovery so you can train harder or more often. But you still have to do the work. It's the synergy that really makes the difference. Hashtag tag 3.3. Sermorelin in age management programs.
That synergy makes sense. So digging into its use in those age management programs specifically, how is it typically positioned there? What's the sort of ultimate goal?
Right. In those clinics, Sermorelin is often a key part of a bigger picture, usually involving optimizing various hormones for middle-aged or older adults. The underlying idea, as we've touched on, is that the GH and IGF-1 axis is often one of the first major hormone systems to decline significantly with age. By your 40s, maybe 50s, your GH output can be way lower than when you were 20, and that correlates with things like losing muscle, gaining fat, slower healing, less energy. So Sermorelin's role is to gently stimulate that aging pituitary, kind of coaxing it to behave a bit more like its younger self. The aspirational goal, to slow down, maybe partly reverse some of those age-related functional declines to support what they often call youthful anatomy and physiology.
Maintaining youthful physiology, that really does sound like the holy grail of anti-aging, doesn't it? But as you said, It's not like there are massive definitive studies proving it reverses aging in healthy people.
You're absolutely right to keep highlighting that. It's a very appealing concept, and it makes biological sense based on what GH does. And there are smaller studies and lots of clinical observations supporting the benefits. But yeah, we lack those huge, long-term, placebo-controlled trials, specifically proving Sermorelin as a standalone anti-aging drug for generally healthy adults. The evidence is more a mosaic clinical experience, patient reports, smaller trials, extrapolations from GH research. For example, you hear patients in these programs talk about feeling younger, more energy, better exercise capacity. Some even report better immune function, like getting fewer colds, which, given GH's known role in immunity, is plausible, but hard to prove definitively from Sermorelin alone in large studies.
Fewer colds, maybe even cognitive benefits you mentioned earlier. That's pretty broad.
It is. GH and IGF-1 have receptors all over, including the brain. So reports of better mood, sharper focus, mental clarity, they come up. Whether that's a direct effect or just a downstream result of better sleep and feeling better overall is hard to tease apart sometimes. But again, it's crucial to state anti-aging is not an official medical indication. We can't claim it stops aging. It's more about managing specific symptoms associated with aging, optimizing function, maybe promoting healthier aging. The medical establishment is generally cautious about labeling things anti-aging. But within a supervised program, Sermorelin is seen as a gentler, potentially safer way to support the GH axis compared to high-dose direct GH. And always, always alongside those lifestyle pillars, diet, exercise, sleep are non-negotiable.
Got it. And sticking with safety for long-term use in these programs, what are the main things doctors monitor?
Safety is absolutely top priority for long-term use. Because Sermorelin works physiologically, it generally has a better safety profile than high-dose direct GH. You tend to see fewer of those classic GH side effects like bad swelling, joint pain, or big swings in blood sugar. But monitoring is still vital. Doctors will track IGF-1 levels starting with a baseline, then rechecking periodically to make sure they stay in a healthy, optimal range, not getting too high. They'll also monitor blood sugar or HbA1c, as GH can affect glucose metabolism, even at physiological levels in some people. And crucially, before anyone starts, there needs to be thorough health screening, especially for cancer. There's a theoretical risk that GH could accelerate the growth of existing tumors. So anyone with active cancer, or sometimes even a history of certain cancers, would likely not be a candidate. It's contraindicated. The really, really long-term data, like decades of use in healthy adults, is still being gathered. So it requires a cautious approach, regular check-ins, open communication with your doctor.
That's super clear on the age management side and the precautions. Okay, let's shift gears a bit. Another area where you hear buzz is around athletic performance and recovery. What makes Sermorelin appealing to, say, fitness enthusiasts or athletes? What's the thinking there regarding muscle gain or bouncing back from tough workouts?
Yeah, it's definitely caught the attention of the fitness world, and for logical reasons tied straight back to GH's functions. For people focused on muscle building, GH is a key player in muscle protein synthesis. That's the process of repairing and growing muscle fibers after you stress them with exercise. So by nudging GH levels up, Sermorelin can potentially contribute to gradual gains in lean muscle and strength, especially if you're also doing resistance training consistently. The gains probably won't be as dramatic or fast as with, say, anabolic steroids, but they're thought to be more physiological, maybe more sustainable.
And what about the fat loss side? GH has a reputation for helping people line out. Does Sermorelin deliver there?
It seems to, yes. GH is a powerful driver of lipolysis, breaking down stored fat for energy. By boosting GH naturally, Sermorelin encourages your body to tap into fat stores more readily. It seems particularly effective against that visceral fat we talked about, so it helps push your body composition towards less fat and more muscle, which is obviously a huge goal in fitness and athletics. Again, it won't magically undo a bad diet, but it enhances your body's ability to burn fat while holding onto muscle during training or even dieting.
Okay, muscle and fat. But recovery. You hear athletes talk about recovery all the time. How might Sermorelin impact that? Like after a really brutal workout?
Recovery. This is arguably where Sermorelin might offer some of its most significant benefits for active people. Growth hormone is fundamental to tissue repair and regeneration, all tissues, really. After you train hard, you create microscopic damage in your muscles. GH is heavily involved in patching that up. It also has anti-inflammatory effects, which could mean less muscle soreness, DOMS, delayed onset muscle soreness. So many users report recovering much faster, less downtime, less soreness, able to get back to training sooner and maybe harder. And beyond muscle, GH is vital for collagen synthesis. Collagen is the main building block for tendons, ligaments, cartilage, your connective tissues. Better collagen turnover means stronger, healthier connective tissues, which is crucial for injury prevention and joint health, especially for long-term athletic participation. Some people report nagging joint issues feel better.
So it's not just about performance today, but maybe staying in the game longer by keeping joints and tissues healthy. That's huge.
Exactly. Better recovery allows for more consistent training, higher quality training, fewer interruptions from soreness or minor injuries. Plus, you have potential benefits for bone health. GH helps maintain bone density, which could be important for preventing stress fractures in high-impact sports. And then there are the potential boosts to energy and endurance, maybe partly from better sleep, partly from optimized metabolism. Some even report better cardiovascular function. It touches a lot of bases relevant to performance and resilience.
Okay, this all sounds like a dream list for a serious athlete, which brings up the big question. Is this legal in sports? Can professional athletes use Sermorelin?
That's the crucial question, and the answer is a clear, definitive no. It is absolutely banned for competitive athletes. Organizations like WADA, the World Anti-Doping Agency, and USADA in the U.S. have strict rules against substances that increase growth hormone levels. Even though Sermorelin stimulates your own GH, the effect is boosting those levels, which gives an unfair performance advantage. So it falls under the category of prohibited substances. It's specifically listed as banned in Olympic sports, professional leagues, pretty much any regulated competition. An athlete testing positive for it would face serious doping sanctions.
So even though the mechanism is different, from a doping standpoint, it's treated the same as injecting HGH directly?
Correct. For anti-doping purposes, the outcome-elevated GH activity is what matters. Its very presence on the banned list, ironically, kind of underscores that it does work well enough to be considered performance-enhancing. But just to be super clear, for the average person, the non-competitive fitness enthusiast, the weekend warrior using it under a doctor's care, if they're not subject to WA rules, it's perfectly legal to use with a valid prescription.
That's a really important distinction. Okay, so for those non-competitive folks who might be interested, let's get practical. What's the reality of using Sermorelin? How do you take it? What are the hurdles? And what should people realistically expect?
Right, the day-to-day realities. These are super important. First off, how it's administered. Sermorelin isn't a pill. It's typically given as a daily subcutaneous injection. That means using a very small, fine needle, like an insulin needle, to inject it just under the skin, usually in the belly fat or thigh. The timing is also key. It's usually recommended to inject it in the evening, right before you go to bed. The reason is to try and sync it up with your body's biggest natural GH pulse, which happens during deep sleep. Now, for some people, the idea of a daily injection, even a tiny one, is a barrier. It requires getting comfortable with needles and establishing a consistent routine. Plus, it usually comes as a freeze-dried powder that you have to mix yourself with sterile water. That's called reconstitution. And then the mixed vial has to be kept refrigerated, so there's a bit more prep involved than just taking a vitamin.
Yeah, definitely not as simple as popping a pill. Reconstitution, needles every night, refrigeration, that's a commitment, especially if you're needle shy or not great with routines.
Exactly. And that consistency is absolutely crucial. Skipping doses or being erratic will really undermine the results, which leads directly to the next big point, the patience factor. Sermorelin is not a quick fix, not at all. Because it works by gently coaxing your body's own system, the changes happen gradually. People often notice very little in the first few weeks, maybe just slightly better sleep. We usually tell people they need to commit to at least 3, maybe even 6 months of consistent use to really gauge the effects. Like month 1, maybe better sleep, a tiny bit more energy. Months 2, 3. Maybe you start noticing skin looks better, clothes fit a bit differently, hair nails grow faster, recovery feels improved. It's often months 4, 6 where people really say, okay, now I'm seeing it. More noticeable muscle tone, fat reduction, better exercise performance. It builds over time.
Wow, 6 months to see full effects. That requires real patience in today's world, doesn't it?
Yeah.
We want results yesterday. Definitely have to play the long game here.
You really do. If you expect instant gratification, Sermorelin will likely disappoint. But the flip side is that because the changes are gradual, they often feel more natural, more integrated, and they tend to last as long as you continue therapy. This also ties into individual variability. Not everyone responds the same. You get high responders who see great results, their IGF-1 levels shoot up nicely, and you get low responders who might not see much difference at all. It depends on so many things: your age, your starting GH levels, your genetics, your overall health. For instance, a younger person who still has decent GH levels might see less change than someone older whose levels have really dropped off. That's why measuring baseline IGF-1 is so helpful.
Right, IGF-1. We keep mentioning that. Remind us again what it is and why it's the key marker here.
Sure. IGF-1 stands for insulin-like growth factor 1. Think of it as GH's main workhorse. GH travels from the pituitary to the liver, and it tells the liver to produce IGF-1. It's mostly IGF-1 that then travels around the body, causing many of GH's effects, muscle growth, cell repair, etc. So measuring IGF-1 gives us a much more stable picture of your overall GH activity than trying to measure GH itself, which bounces around wildly throughout the day. Tracking IGF-1 helps doctors see if the Sermorelin is actually working to boost your GH axis and helps tailor the dose.
Makes sense. Okay, what about side effects? You said it's generally milder than direct GH, but what might people experience?
Side effects are usually pretty mild, yeah. The most common thing by far is injection site reactions. Just some temporary redness, maybe a little soreness, itching, or a small lump right where you inject it usually goes away quickly. Less common, some people might get transient side effects shortly after injecting, like a mild headache, maybe some dizziness, temporary nausea, or a feeling of warmth or flushing in the face. These usually pass quickly too. Serious allergic reactions are possible with any peptide, but they're rare with Sermorelin. For long-term safety, again, because it works with your body's regulation, it's generally considered safer than taking high doses of external GH. We don't typically see major issues like severe fluid retention or insulin resistance if doses are appropriate. But, as we discussed, monitoring IGF-1 and blood sugar is important. And the theoretical cancer risk means screening beforehand is absolutely essential. It's not for people with active cancer.
So, bottom line, gentler than straight GH, lower side effect risk, but definitely not something to mess around with on your own. You need a doctor involved?
Absolutely non-negotiable. Medical supervision is essential. A doctor needs to assess if it's right for you, rule out contraindications, determine the right starting dose, and monitor your progress in labs. Which brings us to access and cost. Since it's from compounding pharmacies, not mass-produced, quality can vary. You need a reputable pharmacy. And insurance almost never covers it for wellness or anti-aging uses, so it's an out-of-pocket expense. Costs can add up. Could be a few $100s a month, maybe more, depending on the dose and pharmacy.
Right, so cost is a factor. And it's not a one-time fix, is it? You have to keep taking it.
Exactly. It requires that financial commitment and the daily routine commitment. And yes, it's ongoing therapy. If you stop Sermorelin, your GH levels will gradually drift back down to where they were naturally. The benefits fade. Some people cycle it, maybe use it for several months, take a break, then go back on. Others use it continuously under supervision. It depends on goals, response, and doctor guidance. So, summing up the practical limits, daily injections, need for patients, results vary, it costs money, and you absolutely need medical oversight. But the good news is, for many people, these are manageable factors, and the therapy itself is usually well tolerated when done right.
That's a fantastic, realistic summary of the practical side. Now, you mentioned Sermorelin has cousins in the peptide world. To give listeners more context, how does it compare to some of the others people might hear about? Let's start with CJC 1295. That one comes up a lot.
Yes, CJC 1295 is a very common comparison, and it helps highlight Sermorelin's specific nature. Both Sermorelin and CJC 1295 are GHRH analogs. So they work on the same receptor, the GHRH receptor on the pituitary, to tell it to release growth hormone. The huge difference between them is their duration of action, how long they stick around and work in the body. Sermorelin, as we've said, is short-acting. It gives a quick GH pulse, then it's cleared out pretty fast minutes to maybe an hour or two. That's why you need daily injections. CJC 1295, especially the version with DH, drug affinity complex, was engineered specifically to last much, much longer. DJs helps it bind to proteins in the blood, extending its half-life dramatically. We're talking days, maybe 6-8 days even. This means it causes a much more sustained, continuous release or elevation of GH levels, and you only need to inject it maybe once or twice a week.
Ah, okay. So CJC is the long-haul version. Fewer shots needed. I get it.
Yeah.
Steady push versus Sermorelin's quick pulse. Is one just flat out better? Or is it about choosing the right tool for the job?
It's definitely about choosing the right tool. There's no single better one. It depends on the goal and philosophy. Sermorelin's short action mimics the body's natural pulsatile rhythm much more closely. Many prefer this because it feels more physiological, respecting the peaks and valleys. CJC 1295 offers major convenience with less frequent dosing, but that sustained elevation is less like the body's natural pattern. In terms of trade-offs, CJC might lead to higher overall IGF-1 levels because it's working constantly. Some feel it might be slightly stronger for muscle fat changes due to that. However, that constant stimulation might also carry a slightly higher risk of GH-related side effects like water retention, maybe carpal tunnel symptoms because the receptors never get a break. Sermorelin, being cleared quickly, is often seen as more forgiving. If you get a side effect, stopping it means it's out of your system fast. It's often chosen by those who prioritize mimicking nature and minimizing overstimulation risk.
Okay, pulse versus push, physiology versus convenience. Makes sense. What about another one you mentioned, ipamorelin? How does that fit in? Is it like Sermorelin or CJC?
Ipamorelin is interesting because it works via a totally different pathway to stimulate GH. Sermorelin and CJC are GHR analogs. Ipamorelin is what we call a ghrelin mimetic, or a GHRP, growth hormone releasing peptide. Ghrelin is often called the hunger hormone, but it also strongly stimulates GH release through its own receptor in the pituitary, the ghrelin receptor, or GHSR. Ipamorelin mimics ghrelin at that receptor. A key feature of ipamorelin is its high selectivity. It boosts GH pretty cleanly without significantly affecting other hormones like cortisol or prolactin, which some other GHRPs can do. Its duration is moderate half-life of maybe a couple of hours, so it also provides a GH pulse, similar in timing to Sermorelin, but through that different ghrelin pathway. And what's really common in practice is actually combining ipamorelin with a GHRH analog like Sermorelin or CJC 1295. Hitting both pathways at once, GHRH and ghrelin, can create a synergistic effect, a much stronger GH pulse than either peptide alone. So ipamorelin is often seen as a partner, not just an alternative.
Wow, hitting two buttons at once for a bigger result. Interesting. What about those other GHRPs you mentioned, like GHRP2 or Nana6 or Hexarelin? How is Sermorelin different from them? And I've heard of Ibutamoren too.
Good question. GHRP2, GHRP6, hexarelin, they are also ghrelin mimetics. Working like ipamorelin through the ghrelin receptor, they are very effective at releasing GH. However, one key difference, and often why sermorelin or ipamorelin might be preferred, is side effects. Those older GHRPs, especially GHRP6 and sometimes GHRP2, can significantly increase appetite because they hit those ghrelin receptors hard. They can also sometimes cause spikes in cortisol or prolactin. Sermorelin, acting only on the GHRH receptor, doesn't typically cause hunger pangs or those other hormone spikes. It's considered a cleaner signal just for GH. Now, ibutamoren, also known as MK677, is different again. It's also a ghrelin mimetic, stimulating GH via the ghrelin receptor. But the big difference is, first, it's orally active. You take it as a pill, not an injection. And second, it has a very long duration of action, about 24 hours. So like CJC 1295 with DT, ibutamoren leads to a sustained elevation of GH and IGF-1 throughout the day, and not a short pulse. Again, convenient but less physiological than the pulsatile release you get from sermorelin or ipamorelin. So for mimicking natural rhythms, sermorelin holds that advantage.
Understanding that whole peptide family really puts Sermorelin in perspective. Okay, let's bring it back to the real world. Can you maybe walk us through a typical patient experience, like a composite story of what someone might actually feel and see happening over time?
Absolutely. Let's create a typical scenario. Imagine John, maybe he's 50, generally healthy, tries to stay active, but he's noticing things aren't quite right. He feels sluggish, that spare tire around the middle won't budge, recovery from his weekend hikes takes longer, maybe his doctor notes his IGF-1 is on the low side of normal for his age. After talking it over, ruling out issues, he decides to try Sermorelin, starting with a standard dose like 0.3 milligram injected nightly. So, weeks 1-3, John probably won't see much in the mirror. But internally, he might start telling his partner, I think I'm sleeping better, waking up actually feeling rested. He might notice just a subtle uptick in energy during the day, less need for that third cup of coffee, maybe feels slightly less foggy. Moving into month 2, now things might start becoming a bit more tangible. His workouts might feel a little easier, maybe he adds a couple of reps, or his usual run feels less draining. He definitely notices he's less sore the next day. That nagging ache after leg day isn't as bad. He might catch himself in the mirror and think his skin looks a bit healthier, maybe his partner comments his clothes seem to fit a bit better. Then, months 3-4. This is often where the changes become more obvious. He might actually see a difference on the scale, or better yet, in body composition measurements, maybe lost a few pounds of fat, gained a pound or two of muscle. Recovery is now significantly faster. The 3-day soreness is maybe down to 1 day. He might also notice other things: improved mood, maybe better libido, or just a general sense of feeling more vital, or, as he might put it, younger. By month 6, John is usually pretty convinced. His follow-up IGF-1 levels have likely climbed into a healthy mid-range, maybe similar to where they were 15-20 years earlier. These objective numbers correlate with how he feels subjectively. He's often quite motivated to continue, seeing Sermorelin is giving him a nice sustainable edge to feel his best. It's not magic, but a steady, noticeable improvement across several areas.
That sounds really encouraging, like a gentle reboot, helping him feel more like his optimal self again. And I like that it's gradual, feels more believable, more sustainable maybe.
Exactly. Gradual feels natural. And it often leads to this interesting phenomenon. Sometimes people don't fully appreciate the benefits until they stop. They might cycle off after 6 months or a year, maybe thinking they don't need it anymore, and then a month or two later, they realize, My energy is dipping again, or wow, I'm really sore after that workout, or my sleep isn't as deep. It's often in the absence that they recognize that subtle but significant vitality boost Sermorelin was providing. It's not a stimulant buzz, just things work better. And that reinforces the point we made. It's not a permanent fix.
Good to know. So it's not like you take it for 6 months and you're fixed forever. It's an ongoing therapy if you want to maintain the benefits, kind of like, say, thyroid medication or other hormone therapies.
That's a very good analogy. It's exactly like that. It supports your body's function while you're taking it. If you stop, your body's natural GH production will eventually return to its baseline level for your age and health status. The benefits associated with the boosted levels will fade. That's why the discussion about cycling versus continuous use comes up. Always guided by a doctor, tracking labs, assessing how the person feels and what their goals are. It's a personalized, ongoing journey. Hashtag outro.
This has been just incredibly insightful. Thank you so much for breaking down Sermorelin so clearly. It really is fascinating how these peptides can sort of bridge the gap between our body's own sophisticated systems and, well, modern medical science. It definitely seems like Sermorelin, used the right way under guidance, holds real potential for people looking to age healthier or recover better.
My pleasure entirely. I agree. Sermorelin is a really promising tool in the peptide toolbox. When it's used responsibly, respecting the physiology, it can make a genuinely positive difference in well-being and how people experience vitality. It's about working with the body.
And before we wrap, it's also fair to mention, while the picture is encouraging, there are still things we're learning, right? Research gaps.
Oh, absolutely. That's always important in science. While we understand the mechanism well and we have good shorter-term data and lots of clinical experience, those really large, multi-year, placebo-controlled studies specifically on Sermorelin for adult wellness or anti-aging and otherwise healthy people, they are still somewhat limited compared to, say, direct GH studies. Most of the very long-term data we have on growth hormone secret dogs might come from related compounds. So more Sermorelin-specific long-term research is definitely needed to fully understand its effects and safety over decades of use across different populations. It's an evolving field.
Good point. Always important to know what we know and what we're still figuring out. Okay, and before we sign off, I need to read our standard disclaimer, just so everyone's clear. The mentioned products and peptides are not intended to refer to any peptides or products sold by Power Peptides. Products sold are strictly for research purposes and not intended for human consumption. So everything we discussed today is for informational context, education. It is absolutely not medical advice. Please always talk to your own qualified healthcare provider before considering any peptide or hormone therapy.
Couldn't agree more. Safety, legitimate sourcing, and professional guidance are absolutely paramount.
Well said. Okay, that brings us to the end of this deep dive on Sermorelin. A huge thank you to our expert for sharing such fantastic insights today. I feel like I learned a ton, and hopefully you did too. Thinking about Sermorelin's ability to gently coach our body's own hormone production, it does make you wonder, doesn't it? How much more untapped potential is lying dormant within our own physiology, just waiting for the right subtle nudge to help us maintain wellness and vitality as the years go by. Something to think about. To all of you listening, thank you so much for joining us on the deep dive. If you found this valuable, please subscribe wherever you get your podcast. Maybe leave us a review. It really helps. We've got plenty more deep dives into fascinating peptides and health topics coming your way. You won't want to miss them. Until next time, stay curious, stay healthy, and we'll catch you on the next deep dive.